Management of Information Standard. Learning objectives. To emphasize the importance of clinical data security and information management in the hospital. To confirm the continuity and importance of documentation in the medical record. To understand the procedures and responsibilities during downtime of the health information system. Management of Information (MOI) standard is one of health organization management standards which is of Joint Commission International (JCI) standards to provide a safe, effective, and well-managed organization. Clinical Data and Information Management Policy. Staff shall comply with UAE authorities in relation to maintaining confidentiality and security of the data and information. Staff shall comply with the security level and accessibility to the patient clinical record. The access to different categories of information defined by job title. All staff at FJH shall ensure their compliance with the following: retention time: inactive medical records for locals for 7 years. Inactive medical records for non-locals for 5 years, obsolete policies and procedures for 3 years, obsolete CPG for 1 year. All retained clinical data and information shall be maintained as per its confidentiality status. Hospital shall protect the confidentiality of any clinical data or information at the time of destruction. Destruction can be done electronically or any other mechanism without compromising confidentiality. Staff shall maintain and protect clinical data and information from loss, damage, and unauthorized access. Maintain manual clinical data and information in locations where damage is not likely to occur. Periodically monitor the unauthorized access of clinical records of patients. All patients treated at hospital shall have their single clinical records defined for them using full name and medical record number. Hospital shall provide training on the proper EMR documentation. Staff authorized to make entries in EMR are encouraged to ensure the consistency of the information. Management of documentation in EMR policy. Staff authorized to make entries in the EMR shall follow this policy. Only one medical record should be opened at a time to prevent incorrect entry. Log off from the computer at the end of the shift to protect patients' information. Staff shall report any documentation error using OBR. Hospital monitors the compliance with the use of documentation in EMR by using chart audit. And implements corrective action as needed. The chart audit results may stimulate further investigations in case of significant variations in the documentation. Only use approved abbreviations. Healthcare providers authorized to make entries in EMR are prohibited from using abbreviations from the prohibited list. These prohibited abbreviations may carry significant adverse consequences when they are used as part of medical record documentation. The review process of the documentation in EMR divided into the following: emergency room assessment, inpatient nurses documentation. Inpatient physician documentation includes discharge documentation, transfer documentation, procedures, operation documentation. Outpatient nursing assessment, outpatient physician documentation, dietitian assessments, social worker assessments, physiotherapist assessments. The review process is conducted by medical staff, nursing staff, and other relevant clinical professionals. The review focuses on the timeliness, completeness, legibility, and so forth of the record, and clinical information, especially prescriptions and orders of the medical record, shall be reported as per the audit tool. Staff shall consider the following when they use option of copy and paste in the EMR: the necessity of using the copy and paste for efficiency and time management. To ensure that the copied and pasted information is accurate, specific, and appropriate to the patient's current clinical condition. To reread the copied and pasted information to avoid any repetitive information before confirmation. To avoid any duplication of information related to the copy and paste process. To ensure the consistency of the information in relation to patient's current condition. To ensure that the copied information is properly labeled and the source of the information documented. Complete the medication reconciliation process before auto-population of the medications into a note. Report any documentation error using OVR, including the abuse of copy and paste in a patient's document. Fujairah Hospital monitors the compliance with the use of copy and paste guidelines. Random sampling will be done to review the adherence to the copy and paste functionality. The medical records review shall be performed at least quarterly or more frequently as determined if an OVR was raised concerning documentation. The use of codes, symbols, and abbreviations in hospital is monitored. Only use the approved method of copy and paste functionality. Electronic Downtime Medical Record Management Policy. Electronic medical record downtime refers to a period of time that a system fails to perform its primary function because of an unplanned event, or because of routine maintenance. Manual hard copies of patient's medical record are available as a standby to respond to system downtime status. Patient's information shall be entered in the EMRs after recovery of the health information system. Healthcare providers should coordinate together to enter the downtime documentation. Hospital shall plan for annual drill to examine the organization readiness to respond to a downtime status. Hospital shall evaluate the result of a downtime drill and develop an action plan to the areas of improvement which requires attention. Leaders of FJH shall examine the consequences of downtime by the post-drill report, and this may include clinical and non-clinical consequences. Continuity of daily operation, patients and staff needs and expectations. The continuity of care. The procedures during the downtime. The temporary MRN will be assigned for all patients who not have MRN. The temporary MRN will be converted to a permanent after the recovery of the system. Downtime forms will be used for registration. Use approved paper forms during a downtime. Use printed report of previously scheduled appointments and update arrivals on this form. The procedure during downtime for patient identification. Use the following patient identifiers: patient's name, and medical record number. Compare patient identifiers on patient's wristband with labeled paper form or report. Allergy history are to be documented. Radiology and laboratory orders will be brought by the patient to the department reception. All transfers and discharges will be maintained manually. The approved forms must be used. All forms must include 2 patient identifiers. Inpatient medication orders will be documented. Physician shall complete the visit note on physician note form. Physician shall limit orders during downtime. When a manual requisition is sent to a department, the sending department is responsible for entering the order into system and receiving department for entering the results. Stat orders will be phoned to department. For the therapies, an investigation, a comment must be added to each order processed during the downtime to prevent duplication. Medications are manually processed on downtime forms and deducted from ACS after recovery. Critical result will be communicated as per reporting critical result policy. The nurse-to-nurse handoff communication will relay information in accordance with handoff communication policy. Routine inpatient results shall be sent to the unit. Outpatient results shall be kept in the patient medical record. Planned admission. The patient will be sent to the unit with the following documentation: the medical registration form, patient admission orders, patient wristbands. If the patient does not have admitting orders, the admitting physician will be called for that. The nursing supervisor will be notified for the new admission. Due to the increased potential for errors during downtime, it is necessary to limit room and bed changes. One normal system operation has been restored, and the recovery process is completed, then room and bed changes may resume.